Hi, my name is Zoe Gilmore, and I'll be sharing with you my Capstone project on the effect of personalized care planning on the quality of life of adults receiving care in long-term acute care facilities. Patients in long-term acute care experience vulnerability, and their care exhibits varying degree of complexities. Patients in LTACs often have extended stays exceeding 25 days. In this time, they navigate multiple comorbidities, chronic conditions, and go through significant life adjustment things like complex rehab and major surgeries. In a year in the U.S., about 7 million people receive treatment and care in long-term acute facilities. However, the current care system leans towards standardized, one-size-fits-all approach to care. In some cases, standardization, especially evidence-based, helps streamline care delivery, but fails to consider human or person or person aspect of healing, such as values, preferences, cultural context, and dignity. We are in people's businesses, so our focus. We are in the people business, so our focus should be on people. As they go through what might be their most trying moments. As a result, I look at the impact of personalized care planning, which embraces patient individuality on autonomy, satisfaction, and ultimately quality of life. Our project offers personalized care as an alternative approach to how we deliver care to patients in LTACs. I suggest a shift from standardized practices to heal our patients wholly. The healthcare system has become more value-based, which implies an alignment of clinical outcomes and patient satisfaction. Personalized care considers patients' diversity during treatment and aims to optimize their well-being through tailored interventions. On the other hand, standardized care models approach are protocol-based, impersonal and rigid. The significance of this project proposal is to bring to focus personhood with regard to care, understanding that patients' lived experience can be as important as their medical conditions. To present and guide the issue of personalized versus standardized care, I used the PICO question. In adult patients receiving care in LTAC facilities, how does personalized care planning compared to standardized approaches affect quality of life, autonomy, and satisfaction with care? I reviewed a number of recent literature on the subject, and there was evidence to suggest that personalized care is not only clinically sound, but also a valuable innovation in LTAC environments. In a nutshell, the literature revealed three dominant themes. First, patient's individuality matters. The authors Dempsey and Mulder in 2023 found that acute care patients hold deeply personal values that affect how they perceive their care. Generic care plans cannot capture this individuality. Secondly, environment and atmosphere influence outcomes. Alamori and Stike noted that patients in assisted living environments thrive when the care atmosphere is empowering and adaptable to their needs. Thirdly, standardized models limit engagement. Dimmer argued that the rigidity of standardized care makes it difficult to adapt care to complex or comorbid conditions, resulting in poorer engagement, limited autonomy, and dissatisfaction. After looking at additional resources, the realization was the evidence consistently support one conclusion: personalized care enables better alignment between patients' needs and healthcare delivery. Personalized care entails the application of patient values, feelings, and goals into the care plan. It requires the development of strategies and consider to incorporate patient's identity. autonomy, and cultural context. Bellner and Aites showed a direct relationship between personalized care and patient trust. They found that the patients perceive their care as individualized, their confidence and trust in their nurses increase, which betters the relationship, leading to satisfaction and better adherence. In addition, personalized care empowers patients by giving them a sense of control and dignity. Patients see themselves as actual partners and a team in their care. The results in this endeavor are reduced medication errors, complications, better care transitions, and increased satisfaction. Despite the established benefits and importance of personalized care throughout the documentation, application remains inconsistent and out of reach for some. The gap lies in operationalizing personalization in the busy world of LTACs. But where there's a will, there's a way. So this project tries to address the gap between practical, evidence-based implementation plan grounded in Lewin's change theory. I advocate for the integration of personalized care planning across LTACs. Personalized care in this context means collaborating with patients to define care goals based on their preference, flexibly adapting care routines to accommodate the patient's autonomy, training staff to recognize and respect social cultural differences, building care environment that values responsiveness and patient input. To achieve these goals, collabing with multiple relevant stakeholders is required. They each play a critical role in both supporting and sustaining this model. The stakeholders include patients, nurses, unit managers, and the hospital board. To this end, I propose a 5-week implementation plan guided by the Lewin's change model, which outlines 3 essential stages of transformation: unfreezing, change, and refreezing. In week 1, we'll read unfreezing. We establish the need for change. Staff engagement begins with identifying the needs to change through presentations, handouts, and discussion forums. In week 2, we set the foundation. Now we define the project's goals, clarify roles and responsibilities, expectations, and outline the resources needed. Week 3, we begin training. We begin to orient and train nurses on how to incorporate patient interviews, developing individualized plans, and collabing across disciplines. In week 4, we'll conduct monitoring, gather feedback, and evaluate emerging data. In week 5, refreezing, we consolidate gains. We'll look at overall effectiveness of the intervention. We institutionalize changes, recognize successes, and build long-term strategies for training and support. The next part is evaluating the approach. How successful is the personalized care? To assess success, we'll monitor both clinical and patient-centered KPIs. We must also be vigilant of risks, since any changes will attract some degree of risk. Some key concerns to watch for include time constraints, survey bias, and staff turnover. One way to mitigate these risks is to implement follow-up training and having ongoing support. I consulted with expert LTAC management. They confirmed that the push toward personalization is overdue, stating that traditional care models have failed to meet the patient's needs, especially in the face of increasing diversity. She also highlighted the challenge of resource, specifically the need for comprehensive staff training and evaluation systems. They insisted that for personalized care to take root in the healthcare system, continuous support and leadership system must be on board. For personalized care and the LTAC to be helpful to as many people as possible, the idea must spread far. Once implemented and evaluated, dissemination will follow a 2-tier program First, we have academic dissemination through a presentation at the nursing conference, such as the Texas School of Nurses Organization Annual Conference. The goal is to encourage a policy and procedural updates that supports personalization beyond the pilot unit and from the bedside to the boardroom for max awareness. My final thoughts. Personalized care should become standard in LTACs. The benefits are improved outcomes, greater trust, restored autonomy. Let's treat people, not just conditions. In conclusion, this project offers a better approach to long-term acute care. The one-size-fits-all model has run its course, and it's time to innovate and treat people as individuals. Personalized care has the potential to improve patient outcomes and invigorate the nursing practice. I appreciate y'all for listening to me to the end of my presentation. Thank you all for your time. Let's work together to improve care for all moving forward. These include patient satisfaction scores, personalized care events, feedback volume, medication error rates, and survey feedback forms.